way the economy is today is just outrageous, and the groceries has gone up.
I had a daughter that was premature and was a single mom, not working at the time. It would help me out a lot.
WIC stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. And basically what it does is it provides nutritional supports to pregnant women, new moms, infants, and children under 5 when they're at their most vulnerable stage. It provides those critical nutrition building blocks such as a monthly food package, a nutrition education, breastfeeding support, and all those kinds of things. The Republicans in the House have proposed a spending bill for next year that would cut WIC by over $650 million.
Our total loss of funding is about $335,000. The way that will translate into our actual practice this year is there are some vacancies that we will not be able to fill, and we did lose an actual person, one of our nutritionists.
When poor people don't have access to the services they need, they tend to have negative outcomes that cost us more. For instance, when we think about programs like WIC, they really help prevent health complications and concerns that really drive up costs in our healthcare system. By just providing mothers and children with healthy food from the beginning, we can have healthier babies who don't draw on those systems.
My son is 2.5. Before I came to this program, I had a whole different concept of nutrition, but once I came here, they also gave me support. They also gave me referrals to programs that are out here that I did not know, and now I know my child has a better future because now I know more about the nutritional facts.
It is possible not just to avoid cutting programs, but to actually invest in the anti-poverty programs that we need to thrive. So some examples would be closing wasteful tax loopholes, would be examining our military spending to see if there's strategic places that we can surgically cut, to examine how we can curb long-term health care costs, and then examining across the entire budget, not just in domestic discretionary programs where the bulk of low-income programs are located, but across the entire budgets for effective and strategic spending cuts. But cutting WIC is not the way to do this. We all know that we have to cut the deficit. We all know it's a long-term problem that we have to address. But how we do it, how we achieve that deficit reduction is going to define us as a nation.